Hello students, myself Dr. Ashok Rana. Today I will be talking about acute biliary colic. That is very important topic from the point of view of emergencies, which is the syllabus for BAMS students final year. So acute biliary colic is the topic of the day. Acute biliary colic. So what is the definition of acute biliary colic? Write down definition. It is the presence of dull ache or spasmodic, steady or intermittent in the upper abdomen, usually under the right subcostal area, that is right hypochondrium. Now this is the surface anatomy of abdomen. We have 9 quadrants. Right hypochondrium, left hypochondrium, left lumbar, right lumbar, left iliac, right iliac, umbilical, epigastric, and hypogastric or suprapubic. Suprapubic. Now, according to the surface anatomy of the abdomen, it is divided into 9 quadrants by 2 vertical lines and 2 horizontal lines. Vertical lines are drawn downwards from the mid-clavicular line, and the horizontal line from the lower part of the right subcostal region, and from here it is iliac crest. Now this is the right hypochondrium. So the patient presents with dull ache or spasmodic pain, which may be steady or intermittent, and it is present in the upper abdomen, may be present here in the epigastrium, usually here it is in the right hypochondrium. The pain can radiate to the back of the chest on right side. Here it can go on the back of the chest. Above it is chest. From here it can go on the back. This is radiation of pain on the back on the right side, or maybe to the right shoulder joint. Somewhere here is the shoulder joint. Here it can also radiate. So second point in the definition is pain can radiate to the back of the chest on the right side and maybe to the right shoulder joint. Pain may last for 1 or few hours. This pain may last for 1 or few hours. So this is the definition of biliary colic. Then what is the pathophysiology of acute biliary colic? That means what is the process of induction of pain? Now due to a gallstone or supersaturation of bile, it may lead to temporary blocking of CBD or cystic duct. Now I will show you the diagram of now this is cystic duct, gallbladder, common bile duct joining with pancreatic duct. You can draw with another color. This is pancreatic duct, and here it forms a common biliary pancreatic duct. And somewhere here is the pancreas. This is the pancreas gland. So it is pancreatic duct. This is CBD. Now what happens? There occurs obstruction here, or it may be obstruction here due to collection of bile salts or a small stone which may have slipped from gallbladder from here during its contraction. जब हम कोई फैटी मील खाते हैं तो गॉल ब्लैडर जो है कॉन्ट्रैक्ट करके बाइल देना होता है उसको, सो दैट वी कैन डाइजेस्ट दैट fatty food. So usually this biliary colic occurs after the intake of fatty meal. So for absorption of fatty meal, bile is to be coming from the biliary duct, and when there occurs a obstruction by stone or by sludge of the bile collection, it can lead to pain in the system leading to biliary colic. This is temporary blocking. It is not permanent, temporary. अगर permanent हो गई तो patient को jaundice हो जाएगी, that will be severe obstructive jaundice. So it is a temporary obstruction. So first is temporary obstruction of cystic duct or CBD. This is CBD, common bile duct. This is cystic duct, and this is gallbladder. Strong muscular, now second point, next line, strong muscular contractions of these to push the stone leads to colicky pain. इसको पुश करने के लिए जो मस्कुलर कॉन्ट्रैक्शंस होती हैं that produces spasmodic pain. So this is the pathophysiology. Then coming to the clinical features of acute biliary colic. Pain, number one, pain usually occurs after ingestion of fatty meals or at night. जब हम रात को डिनर करने के बाद सोते हैं तो 2 बजे के करीब, 11, 12, 1, 2 बजे के करीब हमारे को पेन हो सकती है. तो फर्स्ट इज आफ्टर फैटी मील. Pain occurs after fatty meal. Number two, there is nausea, vomiting, number three, bloating of abdomen. Bloating means patient कहेगा मेरा पेट फूला जा रहा है. Bloating of abdomen. And number five, retching, जिसको कहते हैं डिकार आना. Retching, gastric irritations, खट्टे खट्टे डिकार भी आना. And hiccups, that is हिचकी. So all these features, सबसे important क्या है? Pain, usually occurring after ingestion of fatty meal, maybe at night, usually at about 12 or 1 a.m. Number 2, nausea, vomiting. Number 3, bloating of abdomen, gastric irritations, and hiccup. Then what is the findings on physical examination? On physical examination, number 1, there will be tenderness in the right hypochondrium. So tenderness here only. This part will be showing tenderness, or here all these areas may show tenderness. So first physical examination finding is tenderness will be present in the upper part of the abdomen. Then second important point is Murphy's sign. Murphy's sign, Murphy is the name of the person who described this sign. It is called Murphy's sign. But what is this sign? We press the abdomen here and ask the patient to take deep breath. Patient will hold the breath and will not be able to take breath because of the pain here in the right subcostal region. ऐसे हम देखेंगे पेशेंट को यहाँ पे, और पेशेंट को कहेंगे लंबा सांस लो, तो पेशेंट विल होल्ड द ब्रेथ बिकॉज ही विल नॉट बी able to take deep breath. So this is called Murphy's sign. So on what is Murphy's sign? Write down: on deep inspiration, patient holds breath when examiner's hand palpates deeply. Then third point, jaundice may be seen. Jaundice means yellowness of eyes, and that is yellowness of sclera. Eyes में sclera को देखना होता है. Hard palate, creases of the palm, and then later on skin. So jaundice may be seen if the stone blocks CBD, leading to blockage of flow of bile. So अगर जैसे मैंने डायग्राम बनाई, अगर स्टोन यहाँ पे ब्लॉक कर दिया, so total blockade of bile. It leads to back pressure changes. This bile will get absorbed in the systemic circulation, leading to production of jaundice in whole of the body system. Now then the incidence is more common in patients of diabetes, in females who are obese and fertile. Now some important points regarding gallstones. Now gallstones are formed, gallstone means stones present in the gallbladder. So gallstones are formed due to precipitation of crystals of common salts like calcium bilirubinate and further bilirubin and bile salts. So it's a combination of various elements like calcium, bilirubin and cholesterol. इन तीनों को मिला के मिक्स्ड बाइल स्टोन्स बनते हैं, गॉल स्टोन्स बनते हैं, एंड दे आर मल्टीपल इन नंबर. जो मिक्स्ड गॉल स्टोन्स हैं दे आर मल्टीपल इन नंबर and they are formed by precipitation of these salts in the gallbladder. Single stone, if present, it is because of the collection of cholesterol in the gallbladder, and this is in patients of having hypercholesterolemia in the blood and body system. Sometimes, as during this period of dengue fever nowadays or viral fever, There are so many patients coming with pain abdomen, and on ultrasound examination we find A calculus cholecystitis. A calculus cholecystitis means the patient is not having any gallstone, but the gallbladder is inflamed. So that is called A calculus cholecystitis. A calculus cholecystitis. Then what is the differential diagnosis of biliary colic? This type of pain may be seen in other conditions as well. Write down the differential diagnosis. Number one, most important, is acute myocardial infarction. Number two, acute pancreatitis. Number three, acute gastritis. And number four, gastroesophageal reflux disease, that is GERD. So what is the differential diagnosis? Number one, most important, acute MI. Number two, acute pancreatitis. Number three, GERD. And number four is acute gastritis. So these are important conditions which are to be differentially diagnosed from biliary colic. Then what are the specific points in reaching at a diagnosis of biliary colic? Number one, usually it is a female patient. Number two, 40 years or above. Number three, she is fertile. Fertile means she has produced 2 to 3 children. She is fatty in body weight, and there is family history of gallstones in the patient. That means her mother is also having, her sister is also having. So जो उनकी फैमिली का जो ट्री है उसमें इसकी पॉजिटिविटी मिल जाती है. Then coming to the management, how to manage acute biliary colic. Number one is control of pain by analgesics. Analgesics, that is pain relieving medicines. So first is control of pain. Control of pain by NSAIDs, non-steroidal anti-inflammatory drugs, and antispasmodics. Number two, antiemetics. Patient को vomiting लगी है तो we have to give antiemetics. Number three, PPI, proton pump inhibitors, that is omeprazole, lansoprazole, rabeprazole, pantoprazole, etc. That is, they are called PPIs, proton pump inhibitors. And then four, if the patient is having lot of pain, needs hospitalization, then IV fluids to treat complicated patients like having complications of infection and swelling of the gallbladder. Then fifth part of the treatment is surgical management, that includes cholecystectomy. Surgical treatment is cholecystectomy, that means removal of the gallbladder. It is not the stone which is to be removed, the whole of the gallbladder is to be removed, because the gallbladder having gallstones is non-functional. So cholecystectomy can be done by open surgery or by laparoscopic surgery at good centers. So management is, first important is injection for pain control analgesics and antispasmodics. Number 2, for control of vomiting, antiemetics, then proton pump inhibitors, then IV fluids in patients having complications, and last of all, surgical management by cholecystectomy. Then what can be the complications of gallstones? Very important. That means biliary colic complications are also there. Number 1 is acute cholecystitis. That means inflammation of the gallbladder. That is known as acute cholecystitis. Acute cholecystitis. Cystitis. First is complication is this. Number second complication is acute pancreatitis, because as I have shown, the both ducts, pancreatic duct and CBD connect here. So sometimes the bile goes into the pancreatic duct, leading to the changes in the pancreas and creating acute pancreatitis. So very important and dangerous complication of biliary colic is pancreatitis. Number 3, acute cholangitis. That means inflammation of the biliary tract. Acute cholangitis. And number 4 is malignancy in some of the patient. If the patient doesn't go in for cholecystectomy, then in some number of patients it may lead to malignancy. So these are 4 complications: acute cholecystitis, acute pancreatitis, acute cholangitis, and malignancy of the gallbladder if the patient doesn't opt for cholecystectomy having gallstones. So I personally advise all the patients of gallbladder stones to undergo surgical removal, so that this complication, rather all the complications, can be taken care of. So that's all for the lecture today. So today we talked about acute biliary colic, what is the definition, its pathophysiology, clinical features, and management along with complications. And this is for this is for students of BMS 4th year, in whom we are to teach emergencies in medicine. So I hope you will enjoy this video and will go in for further study in your book, that may be Davidson's Medicine. So wishing you all the best, and I will request you to join my app and download the app and subscribe to it. Thank you.